And I yield back.
Mr. Trone.
Thank you, Mr. Chairman, and Ranking Member Cartwright and Attorney General Garland. Thank you very much for appearing here today. As co-chair of the bipartisan Second Chance Task Force, I'd like to talk a little bit about the Bureau of Prisons and recovery outcomes. The data, it's clear that the best way to reduce recidivism is through stable employment. In fact, the probability of reconviction of someone that's earning at least $10 an hour for 2 months is 8% is the recidivism number for that individual, versus the probability of the unemployed ex-offender is 60%. So just as impacted individuals are prevented from realizing their potential for a number of reasons, including lack of job training. The Bureau of Prison faces severe staffing shortages. The BOP is staffed at 86%. They're funded at 93%, which leads to augmentation, whereas educators, medical professionals, the key people, are forced to work as correctional officers. If they were a business, it would definitely fail. But this not only creates an unsafe prison conditions for the staff and for the inmates, but also affects their ability to program reentry and the ability of the inmates to access literacy classes, job training, substance use disorder, mental health treatment, etc. To make matters worse, extremists would like to drastically cut back to FY22 funding. These budget cuts will harm law enforcement. Could you talk about how decreasing funding to 22 levels will impact the safety of our correctional staff and also the inmates?
Yes, it would be devastating to the Bureau of Prisons, as it would be to all of the components at the Justice Department. It would make the staff less safe for themselves. It would make the prisons less safe for the prisoners. It would devastate our reentry programs and our anti-recidivism programs. BOP estimates that the consequence would be a complete hiring freeze and a furlough of more than 33,600 employees for 60 days. It would require the augmentation problem, which you're referring to, which means having non-correctional officers at work on correctional responsibilities. It would augment the non-custodial staff almost 100% of work hours. And the facilities would really only be able to address emergency requirements, so the First Step Act requirements would not be able to be met.
So meeting the First Step Act would be an impossibility.
Yes.
BOP is also the largest mental health and substance use provider in the country. 159,000 people incarcerated, 2/3 suffer serious mental health, 25% have substance use disorder. If the BOP funding levels are decreased to FY22, how will that affect the Bureau's ability to provide mental health treatment and MAT to inmates?
Yeah, so I don't have a specific breakdown with respect to MAT, but it is of course correct that we've asked for $409.45 million in order to cover all the First Step Act programs, including the medicated assisted treatment. And a 22% cut would mean we would get none of this. So this is just an extrapolation, but I assume this means that we would not be able to provide MAT.
Exactly. Would you agree that one of the leading causes of recidivism and making our country less safe is the lack of mental health and substance use disorder treatment in our prisons?
It's certainly one of the you've put your finger on an important problem, which is that recidivism is a problem with respect to violent crime in the country. The purpose of the First Step Act, which was a bipartisan action by the Congress, is to try to reduce recidivism. And there are a number of ways in which it can be reduced, including all the things you mentioned, including in particular vocational training, but obviously also medically assisted training. If people come out of the prisons still addicted or with a need to get drugs, they're highly likely to recidivate.
Just quickly, solitary confinement. We introduced a bill last year to reform solitary confinement. President Biden has stepped up on this and issued an executive order to reduce restrictive housing. Yet, unfortunately, the percentage of BOP inmates has gone up. What steps is DOJ and BOP taking to implement the President's executive order?
So there are three different kinds of restrictive housing. There is special management units, there's the administrative maximum units, so-called supermax, and then there's special housing units. So both of the first two, which are the most severe restrictions, are down since 2016. The special management unit is down 56% population since 2016. The administrative max, or ADX, population has decreased 17%. Unfortunately, the special housing unit populations have increased. It's not exactly clear, but it looks like a significant part of this is COVID, the difficulty of moving people in and out between different places, and individuals waiting in the special housing units for transfer to designated facilities. The new director of the Bureau of Prisons, who I appointed, has taken this on as a personal responsibility on her part to get these numbers of people in the remaining restricted housing units down.
Thank you. I yield back, and she's doing a wonderful job.
The gentleman yields back. Mr. Elsie.
Thank you, Mr. Chairman. Thank you, General. It's good to be here. We've not met before, but as soon as I shook your hand, I understand that you have some pretty thick skin.